Hello everyone and good evening. Welcome to Gyaan Vardhini session 1. I am Aarti Mishra from Team Clinsav and I am thrilled to be your host today. We have an exciting and informative session ahead and I appreciate each and every one of you for joining us. Let's take a quick look at what we have in our store for today. We will start with the topic of lap and then we'll be opening the floors for your question and answer. Throughout the webinar, feel free to participate in our polls and share your thoughts in the chat. If there is any question regarding the topic, you can always add in the chat box and our team is actively looking into it. We want this to be interactive experience for everyone. I'm delighted to see a fantastic turnout today. Thank you all for being here and investing your time with us. Let's break the ice in the chat. Please share where you are joining us from today and one thing we are hoping you to learn or discuss in this webinar. It's a great way for us to get to know each other. So if you can just share from where and which location you are joining us, it is completely okay to add in the chat box. I'll also introduce the speaker of today, Dr. Snehil Makwana. He has been passed out from Sion College, Mumbai in 2011. Student of a renowned Ayurvedic practitioner, Dr. Devchand Gala sir, associated with him since past 15 years. He has also work experience of 12 plus years of Ayurvedic practice. He is also associated with Dr. Hima Nanavati since last more than 10 years and they are currently practicing at Ayush Clinic. Kandivli in a group practice setup with Dr. Hima Nanavati, Dr. Sanjana Bhole, Dr. Hetal Shah, and Dr. Shrikant since past 3 years. Special interest in treating intellectual disabilities and physical disabilities in children. Also, he has presented a successful treatment cases of Down syndrome and intellectual disability on platform of Acharya Rasayan, conducted by Sitaram Pharmacy, a case presented in the national level journal about usage of Rakta Mokshan in emergency cases of urinary. He is also been recipient of Himalaya Jivak Award and is also a winner of national level art competitions. Next, we can also go on with the instruction of the webinar. Joining the webinar, I hope you all have added on your names. Basically, we have displayed the names. Participants need to keep their microphones muted to minimize background noise. If they have any doubt or question, you can put in your questions in the chat box. Participants can also turn on their video if they are comfortable or for more engagement and interactive environment. You can also use the chat feature for question and comments. Participants to keep discussion relevant to the webinar topic. You can also raise your hand if participants have questions or want to speak related to the topic, but only then when we will move forward to the question and answer sessions. You can also share your questions in the chat box. We will call out your names so that you can ask one by one to the speaker. So, can we just welcome Dr. Snehil Makwana to take this session ahead?
Yes, thank you, Aarti, to introduce me. I congratulate Clinsav team to taking such a great effort in initiation of this Gyaan Vardini. I see this as a IPL match, IPL cricket tournament, where the young doctors like me can showcase their talent, their understanding, their knowledge in the guidance of senior Vaidya, senior practitioners. So it is a great way to share the knowledge, understand and learn. Uh, Here I am a presenter right now, but we work as a team. So I am representing a team of Ayur Seva, where we work under Dr. Devchand Gala sir. So slides also and cases also, which I'll be presenting today, is a effort of teamwork, not an individual work at all. Let me share the screen now. 1 minute. So this today's presentation is guided under Dr. Devchand Gala sir, our mentor, our teacher, our guru. Special thanks to Shrikant Sanmukh sir and Hima Nanavati madam for guiding me throughout the slides. As I said, it is a team effort, not an individual effort. So in treating cases also and presenting the slides also, it is a team effort. Today's lecture is totally dedicated to my gurus. First picture is of Raj Vaidya Kripa Shankar Bhatt. He is a guru of my guru, Devchand Gala sir. Devchand Gala sir is MBBS doctor, practicing Ayurveda since last 44 years. And he went to Raj Vaidya Kripa Shankar Bhatt for more than 14 years and learned the Ayurveda basics. And I have learned everything from the Devchand Gala sir. So whatever I am right now telling or sharing is his giving. Anything lacking is my hina buddhi. So please pardon me for that. Small recitation for my guru. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Para Brahma, Tasmai Shri Gurave Namaha. Okay, let's jump to today's topic. Everyone knows the title of today's topic is Lep. But in such a world where we are discussing Panchakarma, we are discussing Rasha Ushadi, why would someone take a lecture on Lepa? So as I see, Lep comes in the mind as a treatment of Kushta or as a cosmetic purpose, not as a primary treatment. It is the most underestimated drug delivery system explained in the Ayurveda. Anyone in the present participants right now uses Lepa as a primary treatment can put in the chat box in which condition you use Lepa as a primary treatment. I have generally seen people using Lepa as a secondary treatment or assisted treatment, generally for kushta, generally for joint pain or swelling, but not in a way we are using. Today we'll be focusing on one kind of lab, but it will be a guideline for you to explore more. So that's why the today's topic. What is the basic difference in the scientific theory of modern and Ayurveda? We'll come to know why I'm presenting this, but no conflict in between. But what modern science says is it is based on inflammation, infection, and autoimmune treatment. So generally, what by this we mean is they are based on the treatment of the disease or the pathology. But in Ayurveda, what we see is dosha, dhatu, mala, and agni. So we try to make the equilibrium inside the body. So it is the ongoing process continuously to achieve the swasthya state of the diseased person. So that is a main difference between the Ayurveda and modern medicine. Why this? While treating the patient, what we see is, sorry, I am not on the slideshow. Sorry for that. Okay. Now the slides are clear, more open. Okay. So in the treatment, right now what we see in the doshas are in the treatment are dosha dhatu mal, and in treatment we see sam and niram. Sam and niram is not the focus of today's lecture, but still I want to give some glimpse of sam niram. It is most underestimated theory presented in the Ayurveda. Just an example, you can put in the chat box. I can read the answers. If I say aphthous ulcer or mukha paka, what will be the dosha you will be seeing? If you people can write down in the chat box, what is the dosha involved in the mukha paka or aphthous ulcer? Okay, so it is a pitta, right? But I would say it is a sam pitta, not just the pitta dosha. So as I said, sam and niram theory is most underestimated theory which should be applied practically. But today, not the focus on the sam niram theory. Today, not is the focus is on agni, but it is on the dosha marga. What for a new person or a new practitioner or a new student, dosha marga will be koshta shakha gati and shakha koshta gati. So one asks about koshta shakha gati, the person will realize that koshta shakha gati is the screen full kari main already. Aarti, can you see the full screen? I have already.
No, sir, we cannot see the full screen. Can you take it to slideshow?
Yes, I have shared through the slideshow. It is on the slideshow.
Sir, it's not visible to us.
Okay.
Yeah, Dr. Snehil, can
One.
you unshare and share again?
Yes.
Thank you.
Now I have slideshow on my laptop.
Yeah, Dr. Snehil, I'm sorry, this we cannot see the slideshow yet. Or maybe you can just remove the slideshow and make the slide bigger. Or you can hide the left pane which contains the slides.
Okay. Better, little bit better.
Yeah, if you know how to hide the above ribbon, even that could be very helpful.
Now, more better. Last
Yeah.
try.
Yeah,
Is
and yeah,
slide
much better. And yeah, yeah. Thank you, Dr. Snehil.
okay. So as I was saying that treatment part, Sam Nirang, not focus of today's session, Agni, not focus of today's session, Koshta Shaka Gati. So if I'll ask a newcomer, new practitioner of student, what is Koshta Shaka Gati? So he will say or suggest that it is a Vyadhi Marga. So Koshta Shaka Gati is doshas are traveling from Koshta, that is gut, to the periphery. But we need to understand here that this is a physiological pathway or strotas also. So when the person is not in the diseased form, when everything is in the equilibrium, then the Vyaan Vayu will take all the nutrition from the gut to the periphery. But when there is a Agni vitiation or some Hetu Sevan or some digestive issue and ama or some doshas are formed in the gut, they will travel from Koshta to Shaka. But we need to even understand here that no dosha has a gati, no ama has a gati, only Vayu has a gati. So when there is a pratilomit Vayu, then only this doshas or arm will travel from Koshta to Shaka, not otherwise. So if there is a no pratilomit Vayu, this dosha will create a Koshtagat diseases. And if the Vayu is in the pratilomit form, then it will take these doshas to the periphery and it will cause some doshas, some diseases which are related to the periphery, to the Shaka. And which it is called pratilomit Vayu, pratiloman gati or udavarta. Now, when we are treating the patient, primary focus of the Vaidya should be on the anuloman of the Vayu. So, if we achieve anuloman of the Vayu, all the disease, all the toxins, all the doshas will come from Shaka to Kosta very easily, and 50% job of our treatment is done. So, in that anulomana, lep will work. Okay, so this was the basic why the lep is important, how the lep will work, and what the Shaka Gati and Shaka Koshta Gati is. Udavarta and Pratiloman I'll explain in the case study in much more detail. So jump to the basics of Lepa. Nirukti I'll not go into details. Vyakhya, it is simple. Anything which is mixed. Okay. Anything which is mixed in some fluid, some liquid, and mixed with shushka dravya or ardra dravya. So, sorry, pardon me for background music. It is my child crying in background. Sorry for that if it is disturbing. Anything, any liquid, koi bhi dravya अगर हम शुष्क या आर्द्र द्रव्य के साथ मिक्स करते हैं and we make a paste out of it, apply on the organ, it is called lep, as simple as that. Okay, so in that we use takra as a liquid, water as a liquid, gomutra use करते हैं, rose water use करते हैं, aranal use करते हैं, sometimes we even use ghee. So what this ghee, takra, aranal, everything is important in paste. Why we are not applying is it as a dry form? We will learn how, in the mode of action of the lep. It is even called a alep. Major reference in the granthas are Shushut Samhita says in the Vranalepan Bandha Chikitsa, Charak Samhita, Sutrasthan Adhyay 3, Aragadadya Adhyay. Very peculiar in this Adhyay, 42 lepas are explained, 42. But out of that, only 11 are for the question. Just a minute. बात बारह दरवाजे बंद करने बाबू ने बहुत आवाज आ रही है.
Dr. Snehil, sorry to disturb you, but can you
Yes,
just a
yes.
quick check? Just a quick check. Would you be?
Now,
Are you moving the slides? Yeah. Okay. Thank
I
you.
am moving the slide. Sorry for that.
Yes,
I'm
yes.
moving the
I
slide.
can see that. Yeah.
So we are on
Thank
this
you.
slide now. Major references in the Grantha, Lepan with Vidhi and everything. In Charak Samhita Sutrasthan, 42 lepas are explained, but only 11 are for the question. For the topical application in the cosmetic part or the skin diseases. All the other lepas are for the pain, are for the shotha or other treatments. So when lepa come to our mind, now onwards, it should not be just the skin disease kushta, but multiple uses we will be seeing in the coming slides. Sharandhar Samhita also and Bhavprakash Samhita also explains about the Lepa Vidhi in big chapters. Types according to the Sushrut Samhita, which is elaborated. So I have taken only about the Sushrut Samhita right now. It is divided into three categories: प्रलेप, प्रदेह and आलेप. प्रलेप क्या होता है? जो शीतवीर्य है, जो ठंडा है, which is applied thin layer, पतला लगाते हैं. अविशोषी या विशोषी यानी अगर वो सूख जाए तो निकालना है या नहीं सूखे तब निकालना है, which is रक्त पित्त प्रसादकृत. प्रदेह क्या होता है? Remember this slide, प्रदेह वाला slide, because this will be the case presentation slide. इस ये प्रदेह के ऊपर से we will be presenting the today's cases, 4-5 cases. It is Ushna in Virya. It is applied thin or thick depending on the condition. It has to be removed only after it is dried up. It is Vata Shleshma Prashamanam, Shodhan, Ropan, important, Shofa and Vedana Har. Okay. Alepa is thin layer, Rakta Pitta Prasada. Types according to Sharandhar are explained as Doshagna, obviously Vata Pitta Kapha depending on the dosha involved. Vishagna is Jangan and Thavar. Nowadays, we very much less see this kind of practice where Vaidyas use lep in the wish. I have seen a Vaidya in the interior of Ratnagiri where he used mantra chikitsa and lep chikitsa for snake bite. Local doctors refer the snake bite patient to that person, particular person. He does the mantra chikitsa, lep chikitsa, and then only the vaccines of snake venom, anti-venom are applied or given by the injection or shots. So we see very less this kind of practice. Varnavakar, which is cosmetological like Mukhakantikar, Nalika, Vyanga, Nacha, we use very regularly, very basic. What I focus more on, don't just limit your use of lepa to Mukhakantikar, Nilika, Vyanga. Go beyond that, see the short pain conditions also for the use of lepa. In practice, which kind of lepa we see is Virya wise, Ushna Virya and Shita Virya. This is just a small example. Dashang lep, Ushna Virya. Ning lep, Ushna Virya. Suntha lep, Ushna Virya. But sorry, Doshagna lep, I'm sorry, Doshagna lep is Ushna Virya. Dashang lep is Shit Virya. Manuka is dry black resins. सूखे मनुके जो होते हैं उसको हम लगाते हैं बहुत बार. चंदन लेप, which is शीत वीर्य. दोष वाइज वायु पित्त कफ division. शोथग्न लेप for reducing the swelling, and Vishagna lep as I discussed already. What is the significance of lep? It is the most important tool one must use in a clinical practice. Like, I will not say it is the only tool we use. We use Nasya already. Many of you have heard us discussing Nasya, discussing Ashyotan in a daily practice. So this is one of the addition in those lists that Lepa should be used in a daily practice, in the clinical practice. It is mini panchakarma. This word mini panchakarma is coined by our guru, Dr. Devchand Gala sir, but Shushruth also says it as a Adhya Upakrama, first initial Upakrama. very easy to use. It can be used in chronic acute diseases. It can be useful in emergencies. As Dalhan Tika already says, Ashu Pida Haratvata. In acute pain, you can use you can use lep in emergency. Used in any setup. You can use in home setup. You can use in IPDs. You can use in OPDs. You can use in ICUs. You can enter in ICU, use Ayurvedic drugs and recover the patient. You will come to know about those things in the coming case presentation. As a local application, it is used, so no side effects, no H bar. From the above points, you can understand there is no condition applied in this. One more important thing about the LEPA is it is transdermal drug delivery system, which is new term coined by the modern scientists, TDD. So it bypasses the liver function according to modern, obviously. It bypasses the liver function. If you are popping one pill, it goes inside your gut, उसका function होता है, it is absorbed in the liver, then it is travel to the specific function. That whole route is bypassed. It is directly going to the area of involvement. Skin is the largest organ, as we know already. So application on the skin, absorption is very fast. Area of application is huge, and potential and action of the drug is very much fast. So mode of action, very important to understand as Ayurvedic practitioner, theory of how the lep is working. So this is the slide, mode of action, Drava Dravya and Ghana Dravya. We know Shushka Dravya or Dry Dravya we are using, mixing with some watery Dravya, कुछ हम use कर रहे हैं और उसको हम लगा रहे हैं स्किन के ऊपर, as simple as that. स्किन के ऊपर लगाने के बाद क्या हो रहा है, स्वेदवाही मुख जो स्वेदवाही जो ग्रंथियां होती है, स्वेदवाही जो सिरा होती है, उसके मुख पर उसका एप्लीकेशन होता है and it enters into the रोम कूपर. अब ये जो डिवीजन है, जब हमने लेप लगाया, दिस इज द सीक्वेंस इन विच द ड्रग विल वर्क. हमने स्किन पे वो लगाया है, इट विल एंटर इनटू स्वेदवाही सिरा. पहले तो स्किन पे स्वेदवाही सिरा पे एंटर करेगा और रोम ग्रुप में एंटर करेगा. ये पूरे प्रोसेस के अंदर भाजक पित्त जो अवभासिनी में है, इट विल डाइजेस्ट इट, उसका पाचन करेगा. देन इट विल एंटर इनटू तिर्यकगामी धमनी, फ्रॉम विच इट विल एंटर इनटू द इंटरनल ऑर्गन, and then it will work as a virya. If it is a Ushna virya drug, it will work accordingly. If it is a Shita virya drug, it will work accordingly, and the pathology will be breaking inside. Now this sequence look very much fascinating, but we have a right reference from the Shushruta Samhita about it. So let's see what Shushruta says. तिर्यगणानाम तो चतुष्णाम, तो जो 14 प्रकार की धमनियां कही है, 10 above, 10 down, 4 sideways. तो ये जो 4 साइडवेज की तिर्यक धमनियां है, उनके मुख किसके साथ संलग्न है, उनके मुख रोमकूप के साथ संलग्न है. रोमकूप में वो लगी हुई होती है, और जब हम ये रोमकूप के ऊपर कोई भी अभ्यंग, परिषेक, अवगाह या लेप के द्रव्य लगाते हैं, सो उसका पाचन होके, विपक्व होके वो अंतर शरीर में, मतलब इंटरनल बॉडी में जाता है. अब इसका पाचन कौन करता है? सो नेक्स्ट लोग सुश्रुत से त्वची पित्तम तस्मिन भाजको अग्नि. भाजक पित्त यहाँ पे उसका पाचन करता है और वो द्रव्य को अंदर लेके जाता है, और वो कहाँ पे है? भाजक पित्त अवभासिनी में है. So it is written in the Dharmatika. So whatever the sequence I said earlier, it is when we were discussing, me, Shrikant sir, Hima madam were discussing how to write down the mode of action. This was the reference Shrikant sir brought out from the Granthas, and this is the way the Dravya is using. So all the credit for the shlokas and sequences to Shrikant sir. And what works is a Virya. By Virya, it is anything drug, however drug is working is Virya. So Virya to Kriyate Yena Kriya means anything which is working is a Virya by that definition. And anything cannot work without Virya. So na Virya Kurute Kinchit. Virya के बिना कुछ भी नहीं हो सकता. And special instruction to use this lep is प्रतिलोमन. मतलब जो हमारे रोम कूप होते हैं, हमारे जो हेयर फॉलिकल्स होते हैं, उसके ऑपोजिट डायरेक्शन में हमें लगाना है. ऑब्वियसली आइडिया इज क्लियर. अगर हम ऑपोजिट डायरेक्शन में लगाएंगे तो रोम कूप के अंदर एंटर करना वेरी इजी हो जाएगा. अगर हम ऑपोजिट डायरेक्शन में लगाएंगे तो उसका एंटर इजी नहीं होगा. So it is to facilitate the entrance of the drug into रोम कूप, सो भाजक पित्त उसको पचा सके, डाइजेस्ट कर सके, अंतर धमनियों से वो अंदर जा सके और वो वीर्य के अनुसार काम कर सके. सिंपल सीक्वेंस. Variety of dravya we use in the lepa depending on the Ushna Virya and Shita Virya. Rough examples, very limited examples. Coming slides, we will see how much we are using. Ushnavirya, obviously we know Shunthi is Ushnavirya, Marich is Ushnavirya, Hingu is Ushnavirya, Sarshap, राई के दाने उष्ण है, अदरक स्वरस उष्णवीर्य है, comes in the उष्णवीर्य category. शीतवीर्य यष्टि मधु, श्वेत चंदन, सारीवा, द्राक्षा, काले मनु के होते हैं वो, and घृत. Obviously all are शीतवीर्य द्रव्य, simple bifurcation. Today's topic, we are presenting 5 cases. We have used only Hingu and Takralep as a primary drug and only drug in some of the cases. Okay, so why the Hingu and Takralep is the importance? Right now this slide is because we have only used this lep. We will be giving you the guideline how to use lep in emergency treatment, and then with the guideline of this lepa, you can explore more and more lepa in your practice. So why Hingu and Takralep? Easy availability. किसी भी इंडियन किचन में आप जाओगे, हींग मिलने ही वाली है, easily available in any pantry. If person is traveling in the train, if patient is admitted in the hospital, कोई भी pantry में हींग मिल जाएगा, easily easy availability, very cheap, very easy to prepare. We will be seeing how the hing lep is prepared. Easy application, fast, immediate action. So what is the gun of hing? I will be highlighting only the gun which are important for the lep chikitsa. It is ushna, it is tikshna, it reduces the vatabal, it helps in shula and ana. What is the property of takra? It is pachan and rochan, ushna virya, Mudha Vatanuloman, which is written in red, very important. And when we mix this together, what happens, we'll see in the next slide. But why we used takra and why we used it with the hing, there is a reference in the Charak Samhita, takrena yukta yava churna mushnam saksharam. We don't have yava churna very easily available. We don't have shara very easily available. So we replace this with the hing, takra is added in this condition. Even in the doshagna lep, explanation about the RNL is given. So when we mix hinga and takra together, क्या होता है? It becomes ushna virya. It is tikshna, very fast acting. पाचन करता है. Most important property is it does the वातानुलोमन. जो हमने इनिशियल स्लाइड में देखा था, प्रतिलोमन का अनुलोमन करना जरूरी है. So that it is doing अनुलोमन. We will see this clearly in the case studies, which I'll be starting now. Starting with the first case, impacted gallbladder stone in CBD. So I start with a question: how many of you know the caliber or diameter of CBD, common bile duct? What is the diameter? You can put in the chat box. What is the diameter of common bile duct? Question is not for the Hima ma'am. So anyone can put. What is the, no Google search? We are online. You can Google search, but no Google search right now. 10 mm. Okay. Any correct question answer? It is in the range. So diameter of any organ will be in the range from collapsing state to the dilated state. So it is always in the range. So it cannot be the fixed. So anyone knows the range? Very good. 5 mm, 5 mm. Okay. So everyone is active. No one is sleeping right now. 2 to 3 mm. Okay. So 1.8 mm to 5.8 mm. Roughly around 2 mm to 6 mm is the diameter of a CBD. Now you see the impacted stone in this patient is 14.8 mm. Understand the gravity of the situation, how much excruciating pain the person must be suffering from. CBD is 6 mm and impacted stone is 14.8 mm. Pain must be excruciating. 73-year-old male admitted in the hospital during the COVID time, active COVID time. Surgeon decided to operate. COVID test was done. Patient came out to be COVID positive. Surgeons, no doctors was willing to operate under such circumstances when patient is suffering from the COVID. Patient was home quarantine. This case was treated by our teacher, our guru, Dr. Devchand Gala sir. So the patient approached Gala sir and asked for the help in the quarantine situation. Understand 14.8 mm का stone impacted है, gall bladder CBD के अंदर. Sir advised only one treatment, that is hing lep. application of hing lep. No internal medicine was given in such case. Okay, 3 application, pain reduced. Now after 6 days, patient approaches surgeon. After 11 days, sorry, patient approaches surgeon. Surgeon says, okay, you are without pain. You must have done surgery to some other doctor, other surgeon. Patient say, no, I have not gone under any surgery. So surgeon says, there is no pain. Patient says, no pain. I am not on the painkiller also. So surgeon says, you are joking. Let's do the HRCT. HRCT, no stone in the CBD, just hing lep. That's it. Vatanuloman was done, hing lep, within 11 days of time. Okay, so this explanation, this blank slide looks like a fascination. Blunder कर रहा हूँ ऐसे भी लग रहा होगा. This is the report. So if I can zoom, if Anand can tell me if it is visible.
Dr. Snehil, if you can just make it a little bit smaller. Yeah.
Okay.
Yeah, this could be better. This can be better. Yes.
Okay. 15th October reports, gallbladder calculus 14.8 mm impacted in the gallbladder. Within 11 days, HRCT, MRCP was done by the doctor. 26 October, within 11 days, you can read the report. No evidence of intraductal calculus. Only treatment used was the hing lep. Simple hing lep. Most easiest available in the kitchen. Patient was quarantined in the home. What hing lep did, it reduced the Vatanuloman. It reduced the Shotha Anuloman. So I will explain more about Vatanuloman in this particular case. So you will understand the importance of Pratiloman and Anuloman. Just imagine we all have traveled to the mountain roads or even in Mumbai roads also. If the road is blocked with some tree in between, stuck in between, or in the mountains, if the landslide has happened, road is completely blocked. No one can pass through. So when initial vehicles come, the vehicle driver will come out, just try to see if he can remove the obstacle in between and pass through. But this road is completely blocked. So more vehicles are coming from behind. Just imagine more vehicles are coming from behind. And now after 6-7 rows of vehicle, if someone is coming, he will not be knowing आगे तो block है पता नहीं क्या है. So the vehicle coming behind will start honking. बहुत शोर शराबा हो गया होगा, घूंघाट हो गया रहेगा, बहुत सारे लोग बाहर आ गए होंगे. So now there is a cluster of vehicles stuck beyond road, no one can go. So ये जो road block हुआ है ना, that is Margava okay, and the initial part of जो दोष आके वहां पे रुके हैं, they are stuck there, and जब ये cluster of vehicle आके वहां पे रुक गए, that becomes the shoth, local shoth. Okay, now I am very much smart. I am using Google Maps. I am seeing on Google Maps कि यहाँ पे तो road block है, पूरा red line दिख रहा है. What I'll do is I'll bypass the road or I'll reverse my car. So bypassing the road is the tiryak gati of a dosha, and reversing my car is pratiloman. So जितनी भी कार आएगी और मुझे देखेगी मेरी कार उल्टी जा रही है तो विल आज क्या हो रहा है, आगे तो ब्लॉक है, चलो रिवर्स कर लो. तो जितने भी अभी नए दोष आ रहे हैं, they cannot bypass, they are moving backwards or in the tiryak gati. Same happens in this kind of case, obstructive jaundice. जो बाइल सीबीडी से कोष्ठ में जाना चाहिए वो नहीं जाता है, तिर्यक मार्ग से ब्लड में जाता है, इसलिए बिलिरुबिन ब्लड में दिखता है, नॉट इन द स्टूल. स्टूल इज व्हाइट क्ले कलर एंड ब्लड इज येलो कलर. सो बाइल इज रिवर्टिंग बैक, प्रतिलोमन. अब जब हमने हिंगू लेप लगाया तो हमने क्या किया, वहां का लोकल शोथ था वो हमने कम किया, शोथ कम हुआ, स्टोन को मूव करने के लिए इसी पैसेज बना, स्टोन बाहर आया, इट पास्ड अवे इन द स्टूल. नाउ द स्टोन इज नॉट देयर. अनुलोमन हो गया, अनुलोमन हो गया तो शोथ कम हो गया, वेदना कम हो गई, एंड सारी फिजियोलॉजी धीरे धीरे नॉर्मल चीज पे आ गई. टू मेक one point clear, if you can see in the reports, I am sorry, I cannot screen share right now, so reports are smaller in size, but if you can see here, the CBD size right here is 12 mm. So it is not gone back to the original size of 6 mm, क्योंकि वहां से स्टोन निकल चुका है. इट्स अ साइन की स्टोन रिसेंट में निकला हुआ है, इसलिए CBD is little bit dilated in the manner 12 mm. धीरे धीरे over the period of time it will reduce to 6 mm, 8 mm, what is the normal physiological size of CBD. Okay, so I am मोस्टली श्योर दैट अभी उदावर्त और प्रतिलोमन अनुलोमन बहुत सारे वैद्यों को क्लियर हो गया रहेगा डिपेंडिंग ऑन द दिस केस. नाउ वन मोर पॉइंट आई वांट टू ऐड इन स्पेसिफिक दिस केस. This impacted gallstone in the CBD. Sir coined this as a local udavarta, like sectional udavarta. In this section only udavarta has happened. It has not happened at the coastal level, but very much small passage of CBD. So it is a sectional udavarta, local udavarta, which was reduced by the heat lip. Okay. To next slide. So second case, abdomen, acute abdomen. So this was the case. Me and Hima ma'am went into the hospital to check the patient. 83-year-old female was hospitalized for her intestinal obstruction. She had underwent many surgeries in past of her abdomen. So there were many adhesion inside internally. So due to that adhesion, there was a acute abdominal obstruction happened and she was posted for a surgery. So the son and daughter-in-law of this lady came to our clinic and asked for the help if we can do anything in such case. Surgery was post tomorrow, and today evening around afternoon in the 2 or 3 o'clock in the evening afternoon, patient came to our clinic. They asked for help. So in this case, when the patient is admitted in the hospital, make sure if you are going proper permission from the hospital, ask the relative to take the proper permission from the hospital, take the consent of the treating doctor or surgeon, take a written consent from the patient that we are coming whatever is need for the patient. Okay, so we did that. We asked one of our doctor to go in, check the condition. Our assistant was with her. She checked the condition. First application of the lip on the abdomen. Mind well, till now, because of the intestinal obstruction, no flatulence even was passed. As we all are aware about intestinal obstruction, gases bhi pass nahi hote hain. So in such case, no flatulence was also coming out, and stomach was distended, heavily distended, like written in the Shushu Samhita, go puchha akar jo hota hai na, वैसे ही exact condition वो आंटी का था. First application of the Hinglet, within 45 minutes, flatulence started. Once the flatulence started, surgeon got the confidence that we may avoid the surgery in 83-year-old female. So she said, if you want to add something in the treatment, you can add. Once the flatulence was passed, after few hours or few minutes, the sticky smelly stool passed. So we got the confidence that there is some movement in the intestinal obstruction. So we gave the Basti. And with Basti and Hinglep, within the period of 6 days, obstruction was removed. Surgeon was on the day 2, surgeon was confident that this lady does not need the surgery, she can go home. And with few more days, we continued the treatment. We could avoid the intestinal obstruction ka surgery in the 83-year-old patient in the setup of hospital. So we went inside the hospital with the proper permission and we worked. Okay, same principle, Vatanuloman with the Hing and Chash leaf. Okay, so I'm not bluffing again. This is the reports. First report you can see on 17th October, there is a high grade small bowel obstruction due to the adhesions. Okay, probably due to the adhesion, it was due to the adhesions. Within 6 days, reports of 23 October, no evidence of any hernia obstruction as in the previous CT, clearly stating it. Okay, so within 6 days, we could avoid the surgery, we could guide the patient from the severe condition to normalize. After that, after this, obviously 23rd October, treatment lasted for longer time for her to reduce the abdominal girth, abdominal distension. But within 6 days, this was the magical results. Next case, acute gastroenteritis, which is very common in our clinic. We can see this patients any now and then. Patients, आज का खाना तो ऐसा है कि किसी को भी गैस्ट्रोएंटराइटिस हो जाएगा. बाहर जाते हैं, खाते हैं, जो भी मसाले वाला है, विनेगर वाला है, जो भी सारी चीजें खाते हैं, जंक खाते हैं, ये this is a very common situation we see. Patient generally complains of the severe abdominal pain, loose motion and continuous vomiting. अभी जब कुछ भी अंदर गया है and intestine or abdomen is such condition, it is throwing out everything, vomit से और loose motion से. If patient is taking pills also, your pills or your children also, it will throw out. So we don't have anything to intervene. So in modern medicine, what they do is transvenous. They will put IV fluids, but just applying the Hing lep initially will reduce the abdominal pain, will reduce the shotha inside, and will reduce bloating, gases, all the things. And in this case, 43-year-old male, within 3 hours, vomiting, loose motion, everything was down within 3 hours. Now, when the vomiting is settled, we can start using some drugs. So, Hing lep gives us the time to act, what to act. So, उस 3 घंटे के बाद, now slowly and gradually to bring back the equilibrium, bring back the doshas in control, we use some oral medication. Okay. Next, drug-induced rectal bleeding. See, this is also the case. We entered into the hospital. 83-year-old female, known case of bronchial asthma, and she was hospitalized specifically for breathlessness. But in her routine reports, her serum creatinine went up to 3. Doctors were clueless why the serum creatinine is 3. So they did the sonography and they found out there is a obstructed renal calculi of 13 mm. Okay. So rather than working for the calculi, they did the dialysis twice. During this dialysis, she came up with a new symptom of occult blood in the stool and per rectum bleeding. So now doctor was again clueless what is happening. There were no clue how to deal with this patient. Patient's relative being our patient, old patient, they called us. We went around 8 o'clock in the evening with proper, again I will say, with proper consultation and consent from the patient and doctors. We enter the room, check the patient, and we realized that patient was under 5 laxatives at a time. And when we check the per rectum, there was a sticky, very sticky stools. Now understand, patient is showing per rectum bleed, occult blood, and we are advising Hing Chas lep, which is Ushna Vidya, Tikshna in nature. So what was our thought process in this patient is the bleeding from the piles and bleeding occult blood in the stool was because of the too much excess use of laxative. So stools were very much sticky. Then in this sticky stage of stools, pachan is needed. But what they were doing, they were trying to flush out the stools because the stools were sticky. They don't have the understanding of pachan. So with the 5 laxatives, what was happening was there was abrasion inside the colon due to the overuse of laxative, and there was a bleeding. So what we did with the Hingulep here is we did the pachan. Once the pachan was done, when the first application of Hingulep was done, she passed a good amount of sticky stools. Once the amount of stool passed, understand, not her symptoms of bleeding stool stopped, her breathing eased out. Her breathlessness is reduced. Why? Because when there is a udavarta, when there is a adman in the abdomen, understand, stomach and chest is a one barrel divided by the diaphragm. If there is a adman in the stomach, the adman in the stomach will push the diaphragm up, and patient of asthma or any heart disease will not be able to inhale properly, and there will be a shortness of breath. So rather than treating the prana vaha sanstan, you treat the abdomen, you treat the pachan vaha sanstan, you reduce the adman in the body, in the abdomen, and the easing in the breathing will be eased out. Patient will be able to inhale, exhale very easily when the adman is reduced. In specific this case also, no other medication was given. Doctor was happy that we were using only Lepa Chikitsa. It is an external Chikitsa. And second day, he called up and asked, how your Hing lep worked? So Dr. Hima Nanavati, Hima ma'am, explained the person that the bleeding was because of your overdose of laxative, and Hing lep worked like this. He was again clueless how the Hing lep worked. Next case, renal colic pain, 29-year-old man, severe pain in the left side of the loin, left line of the flank, radiating to the inguinal area. So much excruciating. If you ask the patient how much is the kidney stone pain, he would say out of 10 it is 100. That much is the strong pain. I am personally the patient, was the patient of kidney stone, so I know how much the excruciating the kidney stone pain is. Mild nausea was there, and pain was while passing the urine, patient was suffering from the pain. It is classical symptom of renal colic. We did not do the USG for the patient. We just asked to apply a hing lip. This is the patient's words. After applying the hing lip, within just 30 seconds, the pain subsided. This is the patient's own words. Within 30 seconds, pain was gayab. Nahi tha pain wahan pe. So when after the pain was not there, when we did the USG, it was 5 mm stone, left distal ureter obstructed. Because of this small stone, because it was obstructed, it was impacted, there was excruciating pain. And with the large amount of ghee intake and hing lip, we could remove the stone from the system on the same day, night around 10 o'clock. The pain started around 12 o'clock in the afternoon. Stone was out around in the evening around 10 o'clock without any internal medication from our side also. Okay. Ghee was used, large amount I mean 50 ml of cow's ghee. Works wonders in renal stone cases, but our focus today is on the hing lip. So hing lip reduced the pain within 30 seconds in the renal colic pain. Clinical importance, these are the 5 cases I wanted to represent. Lepa Chikitsa, what is achieved? Pain reduction. Obviously, we saw pain is reduced, lightness is achieved, relaxation is achieved. How the lightness and relaxations are achieved? It is achieved by the Vatanuloman. Now we all know what is Vatanuloman, how it is achieved, how we are removing the blockage in the road and allowing the passage. So in the CBD case, we realized that it is the complete block. It was complete. CBD was completely blocked, but it is not the case every time. In the Costa, in Apanvayu Kshetra, see understand, if there is a bottle, our body, imagine it as a bottle, and if it is filled with water completely, and if we put marble inside, what will happen? Water will overflow. Okay, marble is not the natural thing which remains in the bottle. So if we put marble, water will overflow. Likewise, when the disease process are starting and extra doshas are formed, extra arm is formed in the costa, it will not block complete lumen of the intestine or complete lumen of the stomach or the uh, costa, our costa. It will partially block it, but that partial blockage also creates the udavarta. So if we are traveling on the road, if truck is blocking the road, bike wala सब सारे लोग साइड से, साइकिल वाले सारे लोग साइड से निकल जाते हैं, है ना? रास्ता पूरा ब्लॉक नहीं है, थोड़ा ही ब्लॉक है, ट्रक ने ब्लॉक किया है. So partial block also creates udavarta, also creates pratiloman. So in each and every case where we are correcting the costa, Vatanuloman is the primary treatment. 50% treatment is achieved if we are doing the Vatanuloman. Relief in the symptom, correction in the samprapti, yes, it is always there. So now today's focus was on the hing lip. Now these are the conditions we use hing, so many leaves. Udavarta, obviously we all know now. Udavarta hai, we will use hing lip. Adman hai, we will use hing lip. Pancreatitis, cholecystitis, cholelithiasis, appendicitis, renal stone, acute gastroenteritis, you name anything. Thrombus bile, gastric ulcer, duodenal ulcer, pravahika, G bleed, anything. We will apply hing lip, hing and chash lip. Okay. Abscess, we use Shitavirya, sometimes we use Ushnavirya. We use Manuka also, we use poultice also. How the poultice is made? गेहूं का आटा मिक्स विथ हल्दी नमक पेस्ट जैसा बनाओ, उसको लगा दो और वहां पे रखो. Parotiditis and mumps, pain is excruciating. Sometimes shunt and takra lip does not work, so we use marich lip, we use kali jhiri ka lip. Migraine and headache, we use marich lip, we use shunthi and chash lip. Edema of the feet, Ardhakswaras, written in the Granth clearly. कोई भी edema है, you apply Ardhakswaras. Janu Shodh, any joint Shodh, not just a Janu Shodh, any joint pain. Shunthi and Chash lip is advisable. Ardrak lip is also advisable. Ascites, we use Hing lip many times, multiple times, and the results are fantastic in ascites, in cirrhosis of liver, in CA of abdomen, CA of liver, CA of pancreas. Pain killing is immediate in such patients. Endometriosis, hing lip, compulsory prescription in the endometriosis. Pain is so much that lady literally जैसे मच्छी तड़पती है ना पानी के बाहर हम रख देते हैं तो वैसे वो फीमेल तड़पती है, इतना पेन होता है. You cannot imagine the amount of pain. Sometimes patient says जो डिलीवरी का पेन होता है ना उससे भी ज्यादा पेन है ये. So Heimlep works wonderful in the endometriosis patient, same as a dysmenorrhea patient. Nowadays the food is so much altered right now. Young generation जो भी खाना खाती है सब कचरा ही खाती है, उनमें dysmenorrhea is the commonest complaints in the young females. Heimlep works wonderful with the Baddhakonasan and some internal medicine. To increase the endometrial thickness, we have used in one of the patient, जो यूट्रस का एंडोमेट्रियम होता है उसका थिकनेस वी नीडेड टू इंक्रीज फॉर आईवीएफ ट्रीटमेंट. वी आस्क्ड टू अप्लाई जासवंत के जो फूल होते हैं और कमल के जो फूल होते हैं उसका पेस्ट बना के अप्लाई ऑन द लोअर एब्डोमेन इन द यूट्रस एरिया, ओवर द यूट्रस एरिया. Within 2 days 2.7 mm of ET was increased on the USG. Right now I don't have the reports, I can share the reports in the later part. To reduce the burning post radiation, this is very much recent patient, CA breast the patient has. इतना रेडिएशन की वजह से बर्निंग है, अगर हम उसके शरीर के पास हाथ भी रखेंगे तो ऐसे लगता है जैसे वाफ आ रही है बाहर, इतना गर्म उनका बॉडी है. अप्लाइंग द दशांग लेप विथ नॉर्मल वाटर, 95% burning was reduced within one application of dashang lep within the clinic OPD setup. So this kind of leps we can use. Common question answer. Now we are moving towards the question answer Q&A session. I am taking most of the Q&A, so it will be easier for you when to apply the lep. It is about the hing lep. When to apply? When there is a pain, when there is a inflammation, when there is a shoot, you have to apply. One condition, खाके नहीं लगाना है. इमरजेंसी है कभी भी लगा दो. अगर लेप लगाया है तो उसके बाद खाना नहीं है पीना नहीं है जब तक लेप सूखता नहीं है. लेप सूखने तक लगाना है. How often we can apply the lep? We can apply immediately. लेप लगाया, सूख गया, निकालो वापस लगाओ, सूख गया निकालो वापस लगाओ. In such case of 14.8 mm of gold bladder stone, इतना excruciating पेन रहेगा, बार बार लगाना पड़ेगा. CA का पेन रहेगा, बार बार लगाना पड़ेगा. लेकिन जनरल एब्डोमिनल पेन है, आदमान है, we know very simple condition है, you can apply twice a day. Dysmenorrhea, apply when there is a pain, don't apply when there is a no pain. Simple. ऐसे भी कर सकते हैं कि लेप लगाया है हमने और वो सूखने आए तो उसके ऊपर गरम बटर मिल्क लगा दो, so it will activate the system again. How to prepare the hing lep? Very simple. Take fistful of hing, little by little you add butter milk. अभी ये जो बटर मिल्क जो छाछ हम यूज कर रहे हैं वो खट्टा होना बहुत जरूरी है. इमरजेंसी में बहुत बार खट्टा छाछ नहीं मिलता है, छाछ ले लो. छाछ भी नहीं मिलता है, गर्म पानी ले लो. सिंपल मिक्स करो. टूथपेस्ट जितना थिक लेप बनाना है उसका कंसिस्टेंसी टूथपेस्ट जितना होना चाहिए. थोड़ा सा उसको गर्म करो स्टोव पे, इतना ही गर्म होना चाहिए कि एब्डोमेन पे जब लगाओ तो वो चटका नहीं लगे, जस्ट गर्म लगना चाहिए. One of the question I am reading in the chat box is renal pain में कहाँ पे लेप लगाना है? कोई भी पेन है पूरे एब्डोमेन पे लेप लगाना है, पूरे एब्डोमेन पे. It is not just the nabi, whole abdomen from upper डायफ्राम का जो लेयर होता है, रिब केज का लेयर होता है, वहां से लेके साइड फ्लैंक से लेके लोअर एब्डोमेन तक. जहां पे पेन ज्यादा है वहां पे आप कॉन्सेंट्रेशन ज्यादा रखो, लेकिन लगाना पूरे पेट पे है. अंडरस्टैंड, वी आर ट्रीटिंग अनुलोमन, वी आर डूइंग द अनुलोमन. इट इज नॉट सेक्शनल, इट इज होल बॉडी. पूरे सारे सिस्टम इंटरनली कनेक्टेड है. हमको पूरा अनुलोमन करना है, एक ही पार्ट का नहीं करना है, पूरे पेट पे वो एप्लीकेशन करना है. हाउ लॉन्ग यू कैन कीप इट? जब तक ड्राई है. हमने प्रदेह पढ़ा, उसमें क्या लिखा था? अविशोषी. जब तक सूखता है तब तक रखेंगे, सूख जाएगा तो हम निकाल देंगे. विच हिंग टू ये? विच इज अवेलेबल इन द मार्केट. महालक्ष्मी का, वन देवी का, जो भी हिंग हमको कॉमनली किचन में मिलता है वो हिंग यूज करेंगे. व्हाई? बिकॉज इट इज ओनली 11 to 22% हिंग. ज्यादा से ज्यादा उसमें आरा रोट होता है.
Some glitch with Snehil.
Hello, Aarti, you were saying something?
About your last line due to the network issue. Can you just repeat it once again?
Okay, am I audible now?
Yes, sir, you are audible now.
Okay, so which hing to apply is which hing to apply? जो भी हमें मार्केट में मिलता है, वन देवी का, महालक्ष्मी का, जो भी मिलता है वही यूज करना है, क्योंकि उसमें सिर्फ 22% to 11% हिंग होता है. ज्यादा से ज्यादा में अरारोट होता है या राइस फ्लावर होता है. So it reduces the intensity. अगर हम वो खड़ा हींग मिलता है वो लगा देंगे पूरा एब्डोमेन पे होल हो जाएगी, इतना स्ट्रॉन्ग वो हींग होता है. नेवर ट्राई अक्खा हींग यूज करना, ट्राई डाइल्यूटेड वन ओनली, ये ध्यान रखना है. ओके, these are the common FAQs we face for the hing and chash lep. Anything that gives us a new knowledge gives us the opportunity to be more rational. Rather than saying this, what I'll say is anything that gives us the ancient knowledge in a new way gives the opportunity to be more rational. Thank you everyone for attending this session. Thank you Clinsav team to allow me to present my team's work, my sir's work in such a good crowd of 68, 69 people. And if I could make the justice what my sir has taught me, thank you for staying here till end. If any questions are there, we are open for the question answers. 10 minutes we are left with, we can go for a question answer.
Sir, there is one question from, I guess you have answered to Dr. Shilpa for her question. We can go next
Yes.
with Dr. Rahul. Dr. Rahul, you can just unmute your question. I repeat, Dr. Rahul, you can just unmute and you can continue with the question.
Dr. Rahul, is this your question? Do we need to make the takra in hot water? So no, we make takra in normal water. We mix it with the hing and we heat it. We heat it on the stove for few seconds, like 5 to 10 seconds. कि वो लेप थोड़ा सा गर्म हो, इतना ही गर्म हो कि जब हम पेट पे लगाए. स्किन ऑफ द एब्डोमेन के ऊपर जो स्किन होती है वो बहुत सेंसिटिव होती है. जरा भी ज्यादा गर्म होगा तो वो बर्न हो जाएगी. तो ध्यान रखना है कि इतना ही गर्म करना है कि हमें पेट पे गर्म महसूस हो. ये करके देखना जब आपको पेट में पेन होता है. इफ एनीवन इज सफरिंग फ्रॉम द डिस्मेनोरिया और एनी पेन, आप खुद करके देखना कि ठंडा लेप लगाते हो तो क्या इफेक्ट है और गर्म लेप लगाते हो क्या इफेक्ट है. गर्म लेप इमीडिएटली पेन रिलीफ करता है, ठंडा लेप इतना फास्ट वर्क नहीं करता है. सो छाछ अवेलेबल नहीं है तो गर्म पानी में बनाओ, किसी में भी बनाओ, थोड़ा सा गर्म होना चाहिए, ध्यान रखना है. छाछ को गर्म पानी में बनाने की जरूरत नहीं है. एनी विच वेज वी आर हीटिंग अप द लेप. How many times the lap was applied in 14 mm of stone? It was applied multiple times. Three multiple times means एक ही बार में एक बार अप्लाई किया, सेकंड टाइम अप्लाई किया, 3 बार अप्लाई किया. नाउ वो केस में, स्पेसिफिक केस में पेशेंट did not contact after some time, but with the report he came for after 6 days 11 days कि ये देखो ये रिपोर्ट है और ये रिपोर्ट है और हमारा स्टोन चले गया. डॉक्टर भी सरप्राइज्ड है, हम भी सरप्राइज्ड है कि स्टोन गया कहाँ. सर तक्र गरम करने लगाना है क्या? I already answered. In ulcerative colitis, hing lap useful? Yes, very much useful. Which lap for hernia? So hernia, understand, it is due to the adman. It is due to the excess bloating in the stomach. Do the anuloman with the medicine. It is easy. लेकिन अगर इमरजेंसी कंडीशन है जिसमें hernia is blocked, if hernia is in the emergency condition, you can try applying the hing lap and reduce the abdominal pressure. but इसमें और चीजें ज्यादा काम करेगी, जैसे स्मॉल अमाउंट ऑफ बस्ती अगर दिया जाए तो इट विल वर्क फास्टर. जब हर्निया ऐसे कंडीशन में नहीं है जहाँ पे वो ब्लॉक हो गया है, इम्पैक्टेड या स्टफ नहीं हुआ है, तब हम इंटरनल मेडिसिन से हर्निया को इजीली कवर अप कर सकते हैं. उसमें हिंग के लेप की इतनी जरूरत नहीं पड़ेगी. उसमें हम अनुलोमन करते जाएंगे, ऑब्वियसली एब्डोमिनल डिस्टेंशन कम होते जाएगा तो हर्निया खुद ब खुद रिवर्ट होते जाएगा. ओके, व्हिच लेप इन हर्निया
Snehil, sir.
यस.
Sir, I have a question. My question is, number one question is that do you have any experience of using this Lepachikitsa in particularly appendicitis pain? And the second is, in particular case of hydronephrosis or kidney stone, what should be the area where we should be applying this hing lepa?
Okay. May I know who is who are you speaking, doctor? Please, your name.
Sir, myself, Vaidya Ahmed Savani. I am proper from Surat, Gujarat.
Okay. So Ahmed, particular case of appendicitis, myself, I have particular case of renal stone myself I have applied. So जैसे मैंने कहा हमें पूरा उदावर्त कम करना है, पूरा अनुलोमन करना है. So it is not about specific pace. Yes, क्योंकि appendicitis का पेन मैकबर्नीस पॉइंट पे ज्यादा होता है. मैकबर्नीस पॉइंट इज बिटवीन द राइट एंटीरियर सुपीरियर इलियक स्पाइन एंड अम्बिलिकस के बीच में. अगर हमें क्लाइंब मारते हैं तो 1/3 2/3 हम डिवाइड करेंगे तो दैट इज अ वन मैकबर्नीस पॉइंट. वहां पे अपेंडिक्स लोकेटेड है, वहां पे पेन होता है. वो एरिया में आप ज्यादा हींग का लेप लगाओ, लेकिन पूरे पेट पे वो हींग का लेप लगना चाहिए. हमें सिर्फ वी आर नॉट फोकस्ड ऑन द एपेंडिसाइटिस एज सिंगल पर्टिकुलर ऑर्गन, बट हमें पूरे पेट का, क्योंकि ये समझना है हमें जब एपेंडिसाइटिस होगा तो सिर्फ एपेंडिसाइटिस एपेंडिक्स में ही इन्फ्लेमेशन नहीं होगा, उसके साथ आजू बाजू का जो भी एरिया है, स्मॉल इंटेस्टाइन, लार्ज इंटेस्टाइन आर इन्वॉल्व. फॉर एग्जाम्पल हमारे क्लिनिक में हम 4 डॉक्टर काम करते हैं. अगर किसी एक डॉक्टर बीमार हो जाता है तो हम पे उसका इम्पैक्ट नहीं होता, ऐसे नहीं है. सो आजू बाजू का स्मॉल इंटेस्टाइन इज साइलेंट, आराम से बैठा है, लार्ज इंटेस्टाइन इज आराम से बैठा है, सीकम ऐसे ही बैठा है, उसको कुछ नहीं हो रहा है, ऐसे नहीं होता. इन्फ्लामेशन इज हाईएस्ट इन द एपेंडिसाइटिस, बट लोकल एरिया आजू बाजू का जो शोथ होता है उसका पेरीफेरी कम होते जाता है. सो इंटेंसिटी रिड्यूसेस विद द एरिया. सो अगर हम स्मॉल इंटेस्टाइन के डियोडेनम में जाएंगे तो वहां पे इतना इन्फ्लामेशन नहीं रहेगा, लेकिन सीकम में जाएंगे तो इन्फ्लामेशन एपेंडिसाइटिस का होगा ही. सो वो एरिया कम होते जाएगा. सो वी हैव टू अप्लाई ऑल ओवर एब्डोमेन. अगर इवन किडनी स्टोन का पेशेंट है, सो यू हैव टू अप्लाई ऑन द एब्डोमेन. समटाइम वी कैन अप्लाई ऑन द बैक साइड किडनी का एरिया में, अगर वहां से पेन है. अगर स्टोन इज स्टक इन द अपर यूरेटर, पेन विल बी ऑन द बैक साइड और द साइड ऑफ द स्टमक. सो वहां पे हम थोड़ा सा एक्सटेंड कर सकते हैं, लेकिन हम अगर यहाँ का उदावर्त कम करेंगे ऑटोमेटिकली स्टोन नीचे आ जाता है. ओके.
Dr. Snail, there is
Perfect,
one
sir.
of the doctor who's been raising his hand. Dr. Aman, can you unmute yourself and ask your question? I repeat, Dr. Aman, can you unmute yourself?
Yes, good evening, sir.
Yes, good evening, Aman.
Sir, I'm asking कि buttermilk छाछ available नहीं है and we have to add some amla dravya. So can we add little bit of vinegar to it?
You can try and let us know the result. You can try. Aranal is used. If nothing is available, पानी डालो और गर्म करके लगा दो. As simple as that. It also works. Wonderful. लेकिन विनेगर आपने रेस किया है पॉइंट, यू ट्राई इन वन ऑफ द पेशेंट एंड लेट अस नो द रिजल्ट्स.
Okay, okay, sir.
अम्ल द्रव्य ये करेगा कि वो ज्यादा पेनिट्रेट करेगा अच्छे से. दूसरा द्रव द्रव्य जो मैंने ये पॉइंट रह गया बताना, द्रव द्रव्य हम ये लेप में इसलिए यूज करते हैं क्योंकि जो स्किन के ऊपर से एब्जॉर्प्शन होना चाहिए वो जल महाभूत ही लेके जाने वाला है. वो परकोलेट अंदर करने के लिए जल महाभूत बहुत इंपॉर्टेंट है, और जो भी हम लिक्विड यूज कर रहे हैं उसमें जल महाभूत की क्वांटिटी ज्यादा होती है, तो इसलिए हम जल ज्यादा यूज करते हैं लेप में. कोई भी एनीथिंग विच इज लिक्विड इन नेचर.
तो सर जैसे आपने ये बोला तो फिर हम उसकी जगह अगर जैसे क्लिनिक सेटअप में आता है और इतनी कोई इमरजेंसी नहीं है, जैसे आपने बोला आपने हॉस्पिटल में जाके दिया, तो हम कोई अरिष्ट कल्पना भी यूज कर सकते हैं क्या हींग के साथ फॉर मोर पेनिट्रेशन एंड मोर वातानुलोमन, उसमें लेप बना के दें तो?
Okay, we have not thought about it, but as I said earlier also, you can try and let us know उसका रिजल्ट क्या होता है.
ओके सर.
है ना. जब ऐसे सेटअप में हम काम करने जाते हैं ना डॉक्टर अमन, कि जहाँ पे हमारे हाथ बंधे हुए होते हैं और हमारे पास लिमिटेड वर्क होता है, सो वी यूज कि जो इजीएस्ट और फास्टेस्ट मिले. हींग उनके घर पे इजीली मिल सकता है, पानी कहीं पे भी मिल सकता है, ताप कहीं पे भी मिल सकता है ना. आरएनआल शायद या जो भी हम द्रव्य है उनको क्लिनिक से शायद भेजना पड़े. अगर हॉस्पिटल हमारे क्लिनिक से हॉस्पिटल वाज 1 आवर हाफ एन आवर दूर, क्लिनिक पे आओ वापस कुछ लेके जाओ, उससे अच्छा जो अवेलेबल है हम यूज करने की कोशिश करते हैं. लेकिन दिस कैन बी थिंक अबाउट कि ये यूज कर सकते हैं कि नहीं.
हाँ, यस सर.
Next is Dr. Hetal. You can unmute yourself, ma'am. Dr. Hetal, are you available? So next we go with the Dr. Ashish. Dr. Ashish, can you mute yourself and ask the question?
I just want to say certain things, not a question per se. In case of buttermilk is not available, then as rightly said by Dr. Snehil, you can use water, or otherwise you can also use any oil. If possible, til tail, or if not, then whichever oil is available. So even with oil, hing, and pinch of salt, if it is added, and then make it lukewarm and then apply it, that is also giving very good results. Number one. Number second, we can also think of using lab by what we call as nutmeg, jaifal. So jaifal and sont in 4:1 proportion we usually use in clinic for migraine and allied conditions. Then vekhanda, that is vacha, and sunti along with water. Okay, and that is to be rubbed, not to be taken as a powder. And if we can apply that lip on the forehead and the sideways of your nostrils, rather nose bed, there you can apply for sinusitis. So there are multiple ways. Already Dr. Snehil has wonderfully explained various applications of lip, and these are some of the things which I thought that we can also include in our practice. रही बात lastly उदावरत में, what already we have discussed that it has to be applied on abdomen, but sometimes it goes to the Kukshi Pradesh. So when we even apply towards the Kukshi, it will also help. So that part also I wanted to add with. Thank you very much.
Thank you very much, Ashish sir, for attending the lecture. I am very much glad that you attended the lecture.
Dr. Hetal, you can unmute
No,
yourself.
it was really good.
So there is a question in the chat box by Dr. Shilpa Duka for endometriosis, thickness of the lip. Endometriosis thickness, I'm not clear about the question. Jaswand and Kamal flower should be applied on the specific days of menstrual cycle. Understand, we are intent to increase the endometrial thickness. So menstrual cycle, जब menses खत्म हो जाने के बाद, when we were expecting endometrial thickness to increase, तो जो follicular study होता है 7, 8, 9 days के बाद, तभी हम लगाने वाले हैं जब endometriosis thickness बढ़ने वाले before the ovulation. So उसी समय पे लगाना है. In quote, could you please share slide in a group which mentioned different Lepas? Okay, I'll share. Dr. Sajala, I'll share the slides personally. In the appendicitis, we can apply, yes, already explained. In menstrual cramps, I already said. In dysmenorrhea, we can apply. In heart disease also, you have applied any experiences. Personally, in heart diseases, Dr. Hima can explain something about it. I'm not sure about it. Thank you very much, sir. Great insight. Okay. When is the best to apply? Any more questions are there? Arti, from any hand raises are there? You can ask anyone, any doctors. If
Sir,
I'm just
there
reading the
are
chat box, you
sir,
can
there
ask
are
the.
few of the hands raised. Dr. Hetal and
So
Dr. Nitin Goradia.
we can go for two more questions.
Yes, sir, sure.
Okay.
Dr. Nitin, can you unmute yourself? Dr. Nitin, can you unmute yourself? We cannot hear you actually. Or you can post your question in the chat box as well. Dr. Hetal, are you available now to ask the question? Dr. Hetal?
Okay. I'll take the question from the chat box. When is the best to apply empty stomach or having food? Empty stomach is always helpful. Nabi Puran in cardiac emergency can be used. Menstrual cycle already answered. Him lap in ascites, the mode of action remains same. It works on the Udavat, and I already explained the mode of action. Hydrothorax, not the Hinglap in hydrothorax, but many other things. In lung related pathology, what we use is Adrak Swaras. When there is a too much phlegm inside ILD patient, in COPD patient, in bronchial asthma patient, when lung is full of cough, full of phlegm, we apply Ardrak Swaras on the chest, on the backside, on the back, and it works wonders and it reduces the phlegm. One more thing, which is not the lap, but we use is in the bed wetting. We apply castor oil below the navi. So जो पेडू का भाग होता है, below abdomen का, below umbilicus का part होता है, we ask the parents to apply castor oil daily at night to the child, or it works within 1 month of time. We have seen bedwetting stops. So it is not the lab, but I just wanted to share. Ingwastak churna can be used, and most of the questions are answered in the chat box. If any other questions are there, contact details by the Clinsav, great Clinsav team is in front of you. You can ask your personal query on this number or email ID. You can note it down. You can have my personal number also, and we can connect. Thank you so much, Clinsav team, for a wonderful session and arranging a Gyaan Vardini. It was a like a small IPL match for a young player like me, to showcase my talent or showcase my understanding, my thought process, what I learned or I understand from my guru and my teachers and my seniors. Thank you very much.
Thank you, Dr. Snehil, for getting out your time, valuable time for us, and giving us a session. I just want once again to again express my gratitude. Your presence has made this webinar a success, and we hope the knowledge and insight gained today will be beneficial to you in your personal journey. Thank you for being with us for the topic of LAPE, and we look forward to connect with you again at your future events or our future events. Safe travel for on your learning journey and have a wonderful night. Thank you, participants, to join. We hope we create new more sessions for you to help you with the knowledge. Thank you, Dr. Snehil. Thank you, Mr. Anand Nanavati and Dr. Hema ma'am for joining us.
Rita, yeah, thanks everybody to all. And for the remaining questions, we would be reverting back to you individually in the next 1 day's time. Yeah. So we'll be closing the webinar today. Thanks again, and wish you all a wonderful evening, late evening, and good night.
Good
Good night,
night,
Anand. Thank you
everyone.
very much.
Thank you, Dr. Snehil.